So today has been about care closer to home. It's really important given where we are today as a society. We've got to move away from a model that sees people increasingly going into acute hospital care with all of the problems around the system that entails. When we talk about care closer to home, we can break it down into a couple of things, and two of the really important areas which we can see improving are point of care testing and video technology or video consultations.
At the moment, we are making decisions based on limited knowledge of our patients, of our service users. If we could use citizen-generated data from their smartphone, from their exercise tracker, from digital scales, from devices in their own home, we can get a much more rounded picture of an individual. And we all know that the more information a doctor, a nurse or a therapist has, the more reliable and accurate their decision's going to be. That takes precision and personalised medicine into our world. Not the world of the future, but the world of today.
Point of care testing is any test which can be accessed wherever you're receiving care. So if a patient is at a primary care or GP's surgery, they can undertake a blood test there and then and get a result there and then.
There are various ways of interpreting e-consults. I think of it as a means of using technology to deliver consultations by whatever mode, whether it's video, voice, chatbots. They're all different ways of delivering a consultation using some electronic technology. So for me, that's an e-consult.
E-consult is one of the solutions. It's part of a package, it's part of a toolkit that we give to GPs, but also it's offering flexibility to patients, because we must remember the patients are also looking for flexibility as well as the clinical profession. And they're looking for continuity and consistency of care, and by offering flexibility of doing that remotely gives them the possibility of being able to do that.
So I think with digital technology, the ability to connect all of those different point of care testing devices together so that we can ensure the quality of the result we're getting from the point of care testing device, that the result can be made available to anybody in the health and care system that requires the result, so it's not just lost once it's being done, and the ability to bring all of that data together and then apply, whether it's machine learning or artificial intelligence, to interpret and understand the ever-increasing amount of data. So without technology, we wouldn't be able to do that.
We're known as a world leader for healthcare. We need to be just as good as when it comes to technology. The patient population are crying out for it, the workforce population are crying out for it, so we need to get up to speed. So we need to listen to what the workforce is telling us, and we need to listen to what the patients are telling us.
I would hope that what we will see today is colleagues that are commissioners, colleagues that are practitioners of care going away from today with some questions in their own mind about how they could transform the way they provide care, and with a clear sense of where it's been evidenced in other areas, where people have been able to leverage that technology, and where we've got organisations that have come along today and shared their technology and their capabilities, where they can go next to actually get on board, try it out and begin to implement that for the benefit of the population overall.